through my work at University of Michigan, we've identified what we think are like early biomarkers. So a lot of the patients that we studied at University of Michigan were actually all early stage patients with lung cancer. And so through the analysis of that, we found that there's some interesting um, uh, lipid metabolites that we detected, a specific fatty acid called stearic acid. And we find also that there's an association with that stearic acid and macrophage markers, so markers of macrophage inflammation. And so here at the Cancer Center at University of Illinois, my lab kind of worked on the mechanistic validation of that data, and we actually have found, that at least in vitro, in cells, stearic acid can induce macrophages to kind of stimulate sort of the formation of tumors, at least in a dish. So, potentially that's an early marker, even maybe a preventative marker for tumor initiation. And so we're going to do more in vivo work, kind of in mouse models, to see, if our findings hold true. Yeah, so, we already know in the lung cancer space, there are certain patients or individuals that are at high risk for developing lung cancer. Usually these are patients who have a significant smoking history or are currently smoking, and then an age from 50 to 80. These are all patients that then are recommended to get yearly lung cancer screening with a low-dose CT image. Those patients, in the United States, it's about 1% of those patients will go on to develop cancer. But here at University of Illinois at the Cancer Center, we have a really robust screening program. And in our population, which is about 70% African American, we see about 2.5% incidence. So that's, more than double the national average of lung cancer detection here. So in the future, the hope is that early markers that, potentially a lipid marker that we found, we could validate that in our population here, and potentially, is there some sort of lipid therapeutic that we could utilize as a preventative strategy, looking at the downstream immunity, how that is affected. Are there specific cytokines we could target with already, available products on the market that could potentially be a preventative strategy for patients who are at high risk for developing lung cancer? So at least if we're talking about the high risk population, we're not yet really there where we have sort of a biomarker. We have clinical information that we're using to kind of say, hey, this person is at higher risk for developing cancer. But we're not really there, at least in the high risk population, to kind of say, hey, this circulating biomarker is something that, is relating to you going on and developing lung cancer, right? In the early stage setting, there are prognostic biomarkers, most of them genomic biomarkers, things like EGFR and things like KRAS. We know that all of these genomic alterations that are driver mutations in the cancer do have prognostic implications, and now oftentimes predictive implications as well, but that's more in the later stage setting. I think another thing that we're starting to see in terms of biomarker development is the ctDNA development, and we're starting to utilize that more and more in lung cancer. So the way that would look is, patients who go through treatment and then, have ctDNA that's positive even after treatment, especially in the early stage, maybe those are the patients that you prioritize treatment for, as opposed to those patients who maybe have minimal ctDNA or maybe negative, don't express any or aren't detecting ctDNA in the blood. So we have biomarkers like that, but we don't yet really have preventative biomarkers.